I'm very happy to be here to be talking about the distribution of the vaccine. The errors or the glitches that we have had in the system are done, and they have happened. We acknowledge them. We're trying to make things better. But I really want to concentrate on the allocations and the vaccines that we have at hand so we can go forward. And you as the media can help us bring this message to the millions of people that listen to you and that get information from you. And at the end, I'd be very happy to give some information in Spanish so we can get this to the community, one of the communities that has problems with this. And if there's anybody here Creole speaking, I'd be glad to have that for the Haitian and Creole speaking communities also. The governor directed the allocation of the vaccines to Kings Point and Delray Beach. That's when we started, back on December 23rd. The operation, it was on the 30th. The operation was started by the Florida Department of Health. Our nurses went in. We had 24 hours to get ready. We set everything up with the help of the administrative staff at Kings Point. They were wonderful. They have a wonderful location. And we were able to show the governor. The mayor and I sat down and were able to talk to the governor. He was very impressed by the operation, and he thought that was a model that should be kept up. I requested the assistance of the strike teams to come down because we knew we could not sustain that, and we knew that that would be a good model and that the governor would want to continue it. Indeed, he did, and therefore the strike teams were able to take over the next day and continue giving out the vaccinations. They're doing about 500 immunizations a day at those sites. Not only did he extend it to Kings Point, he also went ahead and extended it over to Century Village in both Palm Beach County and Broward. Florida Department of Health is currently vaccinating about 500 people a day through our nurses and through our present location. And we are vaccinating both healthcare personnel and persons 65 and older. That request, they have to have an appointment. We do not want to be like some of these counties that are doing first serve, first come, and you have people lying in cots and in wheelchairs waiting to get an appointment overnight. I will not accept that in Palm Beach County. Anybody that I give vaccine to has to have an appointment system. They have to give out the registration forms and everything be signed up before they get those vaccines. That is a must. The email systems that we have right now, the reason we started that was because of the problems we had with the phones, and that's the best system I have right now to continue honoring the queue that we have these clients that are calling in, as well as making sure that I have all the pertinent information so I can call them back when we're ready to give them the vaccine. We're going to add a statement when they sign up saying that the callback is not going to be within days, it's going to be within weeks to 2 months. And it's simple math. At 4,500 vaccinations per day, I cannot vaccinate 400,000 people. You can do the math. It's not possible. So we need to manage that expectation. Healthcare District is one of our other partners, and they're providing vaccinations to healthcare workers as well as to the patients in the clinics that come who are over the age of 65. The Healthcare District mobile unit is also being deployed based on vaccine supplies, vaccine priorities, demographics, and geographic distribution. We're doing the best we can to make sure that we get to different parts of the community and that it is an equitable distribution to the different parts and the different communities. Based on the governor's announcement on January 4th, there will be some deployment by the state directly to churches and underserved communities. So he has put that in his orders also, and that is something that we have always followed, and that we have the example how we did our testing, that we did that. We took mobile units, we went out to underserved communities, and even to those people who could not go out of their homes. The federally qualified health centers in the county have also received or are receiving vaccines, and they will proceed with the registration with the high priority population to receive vaccines at their facilities for their underserved patients that they see in the community. doses coming to the Palm Beach County is under the control of the state. I am pretty vocal, and I have talked to everybody up at the state, and I can guarantee you that every day I request more vaccine. However, the state does not have sufficient quantity to give everybody what they're requesting at this time. That's a fact. Every single new vaccination has 3 phases. Phase 1 is limited vaccine. That's the phase we're in, and that usually lasts 2 to 3 months. The next phase is where that vaccine starts fluctuating, and that can last another 2 months. And it's not until, as you remember, they predicted that the general population would probably be done in April, early spring to the summer. That's how this is going to happen. This is exactly how all new production of vaccines occur. This happened in 2009 when we had H1N1. And this is happening again now. So this is not abnormal. So we have to be able to adjust and take care of the vaccinations that we're doing. And we know that they will increase over the next several months. And we will understand the amount of the doses with priority of the vaccination and make sure that this wide disparity between supply and demand has driven the vaccine strategy to face the challenges of not having sufficient doses to implement what we want to implement, which is a large-scale vaccination operation similar to what we did with the testing with the drive-thrus. The vaccine is very different than taking a swab on your nose. We have to have chairs in place. We have to observe after the vaccine is given for 15 minutes. And all those factors, including the registration, take time. So it's a much slower process and a very detailed process. As the vaccine supply increase over the next several months, the vaccination efforts and the vaccination strategy will be expanded. This strategy will utilize fixed regional located vaccine centers, points of distribution or pods, clinic operations, and mobile pop-up community sites. Very similar like we did with the testing. So my biggest message for today is 2 simple words. Be patient. Everyone needs to be patient. The county health department expects to receive sufficient quantities of vaccine in the weeks to come to begin a large-scale vaccination effort. The Board of County Commissioners and the Healthcare District of the Palm Beach County are committed to support the state efforts and the goals of getting as many of our residents vaccinated as quickly as possible. We are very blessed here in Palm Beach County to have such a good relationship with our county commission, our emergency management division, and the healthcare district, and a great relationship with the press. So thank you for being here every time we call you. Thank you for getting these words out. Palm Beach County is ready and prepared to equip the facilities for mass distribution of our vaccines. Our current challenge is the lack of supply. It is our hope that the vaccine will become more readily available for distribution in the coming weeks. Therefore, we need to remain steadfast and not let our patience run thin after we have been so strong and resilient as we enter our 11th month of dealing with COVID. The end is in sight, but it's not there yet. So in the meantime, you know my message. Keep your masks on. Keep your hands clean and touch surfaces. And then what comes next? Avoid the 3 C's. Crowded spaces. Stay away from when you see too many people, especially people without masks, and confined spaces where you're in too close proximity, or closed-in spaces where the air may be confined. You know the drill. Keep doing it, and we're going to get through this. We're on the last leg. So help us do that and remain patient. Thank you.